So as part of our oral health, we're very familiar with our teeth, our gums, a lot of other areas, but we don't talk as much about the tongue. So there's a treatment, a very important one for oral health called tongue rejuvenation. What is it? What does it cure? What is important for people to know? And for a tongue rejuvenation expert, we have Dr. Pashmina here with Serenity Dental. Welcome.
Thank you so much.
All right. So for a lot of folks who aren't aware, most myself included, please tell us what is tongue rejuvenation and why is it needed and what does it do?
So tongue rejuvenation is kind of a niche procedure that some dental offices are starting to do. We've been so focused on teeth cleaning and deep cleanings and flossing and all of that, which we are completely ignoring that big piece of muscle in your mouth called the tongue. Everything we eat leaves deposits on our teeth, and it leaves a deposit on our tongue. Every 6 months you come in, we clean all those little tartar pieces and calculus pieces from between your teeth, but the same thing is happening on the hair-like structures on top of the tongue. A lot of it is in the back of the tongue. There are patients who constantly complain about having bad breath, even though they floss, even though they brush, even though they brush their tongues. But this is usually a procedure we do on patients who have persistent bad breath. Nothing cures it. Or if we see a lot of deposit on the tongue, they're just not cleaning it. And sometimes just brushing the surface is not good enough because deep inside the papilla on the tongue, there's so much buildup, just like the buildup between your teeth, that you cannot just clean at home. It's a service we provide for our patients. It's something that's not covered by dental insurance, but it will definitely improve the breath quality. It's something that you would have to come back for every 3 to 6 months for maintenance procedures where we go in, we teach you how to clean your tongue at home after we do the initial cleaning. You have to keep up with that. Diet plays a huge role with our breath. So certain products like dairy, yogurt, yes, we're being very healthy eating yogurt and cheese and dairy products, but our tongue doesn't like it. It sticks all
Oh
the way
no,
into
not
our tongue.
cheese, not yogurt. Oh, come
Coffee.
on.
Coffee is a really big culprit. Alcohol is an
No, no,
issue.
not
It's all going in there. You have sauces, so any cream-based sauces, any tomato sauce, like these are things that literally get soaked into the tongue. And unless we clean it professionally, it is not really going to be easily removed. So it works in conjunction with your regular 6 month cleanings. We want to make sure that there's no other cause of bad breath. So if you need a deep cleaning and you haven't had your teeth cleaned for 10 years, then obviously we need to focus on the deep cleaning first and get your teeth cleaned up. But that also comes with the tongue cleaning as an additional procedure that we usually recommend to get rid of all the bacteria and the biofilm in the mouth.
Gotcha. Very insightful. So for some folks, either for themselves or for their spouse or significant other, if there's been persistent bad breath and they've tried lots of things and they're kind of stumped, it could come down to the tongue, it sounds like.
It could
So,
very much be that. Some patients like to just use a lot of mouthwash throughout the day. And mouthwash, yes, it neutralizes the odor for a short period of time. But if you notice, it comes back. It comes back just as soon as in an hour after you use the
mhm.
mouthwash, the breath is back. So those are the cases that really benefit from the tongue rejuvenation because that's the culprit. You're cleaning your teeth. There's nothing else in there to clean but the tongue.
Gotcha. Wow. Definitely informative. I think the tongue gets looked over quite a bit, but obviously it's very
Yeah, for
important for
sure.
oral health and for those who are wanting to treat that bad breath. So, very informative. Thanks for your insight today on tongue rejuvenation, Dr. Pashmini. Appreciate your time.
Of course. Thank you for having me.
All right. Have a good one.
You too.
Bye.